Hello everyone, I am Dr. Divya, Narayana Medical College, Nellore. Today I am here to talk about World Thalassaemia Day, which is observed on 8th May every year. Thalassaemia is a rare hereditary blood disorder affecting 4.4 per 10,000 live births globally. Though it is rare, it disrupts hemoglobin production, making millions of the people who are affected with this disease dependent upon lifelong blood transfusions. World Thalassaemia Day was observed on 8th May every year globally. This was observed by International Federation for Thalassaemia, which was established by Panos in memory of his son George, who lost his life in battling with this disease. This day also highlights the struggles faced by the patients and also advocating new healthcare policies and promoting research towards aiming at the cure for this disease. What is thalassemia? Thalassemia is a genetic disorder that affects the normal production of the hemoglobin. Hemoglobin is a protein that is present in RBC which has oxygen carrying capacity. Thalassemia is broadly divided into two types, alpha thalassemia and beta thalassemia. In India, beta thalassemia is more frequently seen. Who are at risk for thalassemia? Individuals with family history of thalassemia and individuals who belong to high-risk ethnic groups like Mediterranean origin, African origin, Southeast Asian country origin or Middle East origin people are at high risk for thalassemia because these regions are endemic for malaria. Children born to carrier parents are at risk of having severe thalassemia, though they may not have severe thalassemia, but there is chance of having carrying gene to the next generation. In population with limited access to treatment and screening programs are at risk of presenting with late stages of thalassemia and also ending up with the complications like end organ failure. As in low and middle income countries, there is lack of awareness and also lack of any screening programs leading to such complications. How does thalassemia affect our body? Thalassemia initially presents with moderate to severe anemia, that is hemoglobin less than 7 gram per deciliter, and presenting with clinical features such as easy fatigability, weakness, jaundice secondary to hemolysis of the RBC and also with breathlessness. And in later stages, because of overactive spleen presenting as splenomegaly and also patient is at increased risk of multiple infections. In late stages, iron overload presenting as end organ damage like vital organs such as heart failure, liver damage and also multiple endocrinopathies. How this condition is diagnosed? With the help of basic investigations like complete blood profile and peripheral blood smear examination will support the diagnosis and hemoglobin electrophoresis will confirm the diagnosis. What are the current treatment options available for thalassaemic patients are regular blood transfusions for moderate to severe thalassaemic patients to support their growth and development, iron chelation therapy to combat iron overload, splenectomy in case of splenomegaly, and bone marrow or stem cell transplantation from a suitable compatible donor, preferably from sibling, and gene therapy is an emerging modality of the management in thalassemia. What challenges do people living with thalassemia face? As this is a long-term chronic disease, they require multiple medical attentions and this will become financial burden to the family as well as to the patients, and these people will suffer with social stigma. And as this is a genetic conditions, there are some cultures where there is social stigma about these genetically inherited conditions. These patients will also face multiple emotional and mental struggles. As this is a lifelong disease, they experience anxiety and depression and feeling of isolation. And what we all can do to support thalassemia community? By donating the blood regularly at every 3 to 6 months interval, which reduces the shortage of blood to the thalassemia patients. Raising awareness about thalassemia in general public and also encouraging the patient for genetic counseling as well as pre-conceptional screening, giving emotional support to the patients and also participating in World Thalassaemia Day initiatives, we can support thalassemia community. Finally, the theme of World Thalassaemia Day 2025 is Together for Thalassemia, uniting the communities, prioritizing the patient first. And this theme is also followed with a powerful slogan, We are one, patients first. Thalassemia is more than a clinical condition. So this year theme emphasizes on prioritizing patient-centered approach where care extends beyond treatment, encompassing holistic approach, dignity and empowerment of the patients. On this World Thalassaemia Day, I conclude that by standing together as united global community, we can bring a meaningful change by ensuring needs, rights and voices of the people suffering with thalassemia are not only recognized but also actively prioritized. Thank you.